So today we're going to be talking about one of the most asked questions when it comes to diabetes. Everybody wants to know if diabetes can be reversed and how to reverse it. But we have to talk a little bit about the different types of diabetes before we can get into whether or not diabetes can be reversed. All right, so welcome everybody. My name's Alexandra. I am the founder of RX Health and Wellness, and we love to help people with diabetes get healthy and possibly put their diabetes into remission. So welcome to this YouTube video on whether or not we can reverse diabetes. So this topic is one that is really polarizing, probably one of the most misunderstood topics that there is. And as the rates of diabetes raises and goes up year after year, it becomes even more confused for people as they get diagnoses to know what to believe in. So in this video, we'll talk a little bit about the difference between type 1, type 2, and gestational diabetes, what the key differences are in whether or not they can be reversed. So let's start with what is type 1. So type 1 diabetes happens in young adults. And usually children and young adults, and usually they require insulin for the rest of their life. So what this means, it's an autoimmune disease that destroys their ability to make insulin, and therefore this type of diabetes cannot be reversed. There are many things going on, studies creating, mechanical pancreas and so on. But as of right now, there's nothing other than the use of insulin. You can have insulin pumps, and we have very smart insulin pumps nowadays as well. All right, let's talk about gestational diabetes. Gestational diabetes is when a woman gets pregnant and her blood sugar start to go up, usually around the 28th week of gestation. So usually for these women, this type of diabetes will be resolved when they have the baby. The only thing is that they are at higher risk for getting type 2 diabetes later on in life. So they should be really careful and try to diminish the risk factors for type 2 diabetes. Now let's talk about type 2 diabetes. So type 2 diabetes is one where we start with insulin resistance, meaning your body's still making insulin, but your body doesn't recognize that insulin, so it doesn't work the way it's supposed to. And what is this? Why does this happen? This happens because of insulin resistance, meaning something is interfering with the way your body works. Usually has a lot to do with chronic inflammation, lifestyle, what you eat, stress levels, also your level of toxins. There are now many toxins that are known to cause diabetes and are also known to be obesogenic, meaning they can cause you to gain weight, which can lead to insulin resistance and then lead to higher blood sugars. So this type of diabetes can be put into remission. So what does that mean? So let's talk about the difference between what reversal is and what remission is. So reversal implies that you can go back to the way you were previously to having higher blood sugars and having insulin resistance. and going back to quote unquote normal. Remission means that you are able to get your blood sugars back to normal ranges, and you're doing it without the need for medication. Now, remission doesn't mean you completely reverse your diabetes, because there is no reversing. Unfortunately, as your blood sugars go up and your body doesn't recognize that insulin, your body will tend to make more and more of that insulin, which can lead to your beta cells, those are the cells that make insulin, to burn up and the numbers to be diminished. It also means every time your blood sugars goes up, that you've created that chronic inflammation, and you already started to affect some of these other organs that usually lead to complications of diabetes. And of course, the largest complication is cardiovascular disease. So we know that as long as you're already having higher blood sugars, you're already affecting your cardiovascular system. So we can't completely reverse whatever effects have been done. But you can certainly put your diabetes into remission, and your body can act as normal as it can, as long as you keep your new tools and new lifestyle the same. If you go back to the way you were before and doing the same things that led you to have type 2 diabetes, then your blood sugars are going to go back up again, and diabetes will resume its course. It's a chronic disease that progressively gets worse if you don't keep it under control. All right, so we want to make sure you understand the difference between reversal and remission. So for most people, when they're talking about reversal, they're actually talking about remission. And it is something that can be obtained with the right tools, the right lifestyle, and just getting healthier overall. Now, some people may need to continue some of their medications in order to keep their levels on, under remission, depending on how far, how much damage, how long they've had diabetes, and complications of diabetes as well. All right. So what are the biggest things that you can do to get your type 2 diabetes under remission? So the biggest one is probably weight loss. As we have higher weights, it can lead to having insulin resistance. How it works, we're not completely sure, but it does. So the higher your weight, the higher your insulin resistance. You only need to lose about 5 to 7% of your current weight to kind of reset your blood sugars down. But the closer you get to a normal, so-called normal weight, then the better it will be for you, and the easier it will be to get into that remission zone. Lifestyle. This is one of the biggest things that you can do, starting with diet. Diet is probably 60 to 70% of getting your blood sugars under control, but even more important to get them under, under the goal to more normal blood sugars. So getting yourself to that remission level. So diet, exercise strategies. We also need to talk about stress management and sleep. Having a good night's sleep is really, really important for blood sugars. For women, we also need to talk about hormonal changes, especially during perimenopause and menopause, that can lead to higher blood sugars, more uncontrolled blood sugars, and make it a lot harder to get those sugars under better control. But we want to make sure we also get to the root causes of some of these symptoms. So there are many reasons why you get diabetes. Of course, the biggest ones are lifestyle and, of course, being overweight. But there are other causes such as toxins in your environment. There's also dietary imbalances. There's also just mental health issues that can increase your blood sugars due to stress and anxiety. So in functional medicine, we try to find what the root causes are and how to balance your life and make it more normal. Your body's a wonderful, wonderful machine, and it knows what it needs to do as long as it has everything it needs to repair itself. So we use food as medicine to get you back to a more normal, healthier you. So health and illness is a continuum. Think of it as a line. In one side, you're healthy, on the other side, you're sick. And you move back and forth throughout your life. As we start getting older, we start moving more toward the illness type side. So we need to get our gut health under control. Gut health is probably one of the most important things that you can do to reverse or to put your diabetes under remission, and is often overlooked. Your gut health is a primary thing that we need to address in order to get you in remission. We also need to start looking at toxins and decreasing your toxin burden, meaning the amount of toxins that you are exposed in your house. And we're talking about cleaners, we're talking about cookware, we're talking about personal care items, we're talking about food like pesticides, all of which can lead you to become insulin resistant and get diabetes. We're also talking about chronic inflammation due to stress and other things such as your diet, and reducing that chronic inflammation in order to reduce insulin resistance and get your blood sugars under better control. So let's reframe the idea of reversal of diabetes, because there is no cure. So we need to think about putting it in remission. It's about reclaiming your health. It's having this diagnosis, whether it's pre-diabetes or diabetes, it's a wonderful opportunity for you to get yourself to reclaim your health, start working on being healthier, and start working on managing your blood sugars better, and then putting them under better control, and then getting them to a point where you can be in remission from your diabetes. Please visit our website. We have a wonderful article on the difference between reversing and remission of diabetes that you can read all about it. We'll link it down below for you. We also invite you to subscribe, like, share, and make any comments below. We'd love to learn more about what your interests are. And as always, RX Health and Wellness is here to help people with diabetes manage and put their diabetes into remission. So I'll see you guys later. Bye-bye.